The hysterectomy is one of the most common surgical procedures done in women. Today we're going to talk about the total vaginal hysterectomy. When we talk about vaginal hysterectomy, we're talking about removing the uterus through the vagina. If that sounds good to you, continue watching. Well, if you're new here, welcome back to my channel. My name is Dr. DuPont. I'm a board-certified gynecologic oncologist, and I am passionate about educating women to live healthier lives, and I believe all that starts with great health. So today we're going to talk about the total vaginal hysterectomy. If you want more information on hysterectomy, I have several videos on treatment of common gynecologic cancers, recovery after hysterectomy, total abdominal hysterectomy, total laparoscopic hysterectomy, and this one today, the total vaginal hysterectomy. So what is a vaginal hysterectomy? So when we look at the uterus, it's pretty much removing the attachments that hold the uterus in place and pulling it through the vagina. It's a very common procedure, it's easily done, and it actually has really good results. So the first thing when we think about is a total vaginal hysterectomy is we're thinking about removing the uterus and cervix. So when you're doing a total vaginal hysterectomy, the uterus and cervix will both come out. The ovaries may or not be removed, and that'll depend on your age and depend on the reason why you're having surgery. So your doctor will let you know what type of hysterectomy they recommend for you, and this is just one of the many types. Again, some of the other types of hysterectomy are total abdominal hysterectomy, a laparoscopic hysterectomy, or robotic assisted hysterectomy, which is a form of a laparoscopic hysterectomy. Well, when your doctor talks to you about the total vaginal hysterectomy, they may first get medical clearance. Depending on your age and your health status, you may need to see a cardiologist for cardiac clearance. You may need to see your primary doctor for medical clearance. Typically, the vaginal hysterectomy is done in a surgery center or a hospital. The procedure usually is very quick. Most patients go home the next day and do very well. One of the common benefits of a vaginal hysterectomy is that it actually is less expensive than other forms of hysterectomy. You don't need a lot of fancy equipment to do it. You do have very good success rates, lower blood loss, lower infection rate, decreased complications. Now, some of the disadvantages, though, it does require surgeon skill. So you have to have a surgeon that's very experienced and does this a lot. And so not all doctors, were trained to do a vaginal hysterectomy. Most of us were, but a lot of times we don't do it as often as some of the other types of hysterectomy. Another disadvantage is that if you have like an ovarian mass or prior surgeries, let's say you have a lot of adhesions, your doctor may not be able to remove the vagina remove the uterus through the vagina because of scar tissue. Let's say you had 5 C-sections. Well, you may not be a good candidate for a vaginal hysterectomy. Your doctor will let you know if that's feasible. A lot of times if you've had multiple surgeries, it just makes it harder. Another disadvantage of the vaginal hysterectomy is if you have a very narrow pelvis, or maybe you haven't had children. Sometimes that's a lot harder to do vaginally than other forms of hysterectomy. And if you have like a big tumor or ovarian mass, likely your doctor won't offer you a vaginal hysterectomy because those big masses are hard to take out through the vagina. Typically, the vaginal hysterectomy is done for patients with normal bleeding, fibroids, someone that has pelvic pain, or even pelvic organ prolapse. That's a very common reason why we do a vaginal hysterectomy, and oftentimes at the time of hysterectomy, your doctor may do other procedures such as, lift your bladder or fix some prolapse. Let's say you have, a bulge in your rectum or a bulge in your bladder. The doctor may fix all of that at the same time as your vaginal hysterectomy. So that's actually one of the benefits. So typically the technique is really simple. We remove the attachments that are holding the uterus in place, and we pull the uterus through the vagina. It's a very safe and quick procedure. Because it's a faster procedure, there's less anesthetic time, and again, overall it's less cost because we're not using fancy equipment to remove the uterus. Then typically after surgery, your doctor will talk to you about pelvic rest, so not putting anything in the vagina. Usually we'll say for 6 weeks, we'll say no swimming, no tub baths, no tampons or douching, nothing in the vagina to allow those sutures to heal and also to reduce the risk of infection. And then typically your doctor will see you back 1 to 2 weeks after the surgery to go over the pathology report and to check to see how you're doing. Well, the vaginal hysterectomy is one of the safest and quickest types of hysterectomy. It's not done as much because it does require surgeon skill, and so not a lot of doctors do it as much as they used to, let's say 20, 30 years ago. But it's a great procedure, and if you've had a vaginal hysterectomy, you want to put your comments below. Let us know your experiences and how you did with your surgery. Well, I hope that was helpful for you today. I do have some other videos about different forms of hysterectomy, so definitely watch this video next. Thanks for watching, and I'll see you in the next one. Bye-bye.